It's a very large area. There was bleeding, excessive bleeding. I'm gonna undermine the tissue.
My name is Christian. I'm 22. I'm from Yonkers, New York, and I'm a bartender and manager. In high school, people would come up with some nasty remarks. In the locker room, stuff like, "Hey, why do you have boobies?" Can't remember a time without it. I've had it my entire life. I never thought of it as anything other than my being just overweight. When it really began to bother me was probably in around high school. I'd always be tugging on my shirt so that the clothes would just fall right, but I never quite felt comfortable. I absolutely think that after I have this surgery, I'm going to be more attractive. That's the point of a cosmetic surgery.
How are you, Christian? Okay.
This is chart.
Thank you, Marianne. Okay, Christian. I know from talking to you that you're very realistic. In your case, it's a severe case.
I'm concerned about going under the knife.
Infection is possible, but it's unlikely in this office. Now, recurrence of the gynecomastia is about between 10 and 35%.
The surgery has a very high success rate. It's extremely unlikely that this will grow back. If they do grow back, he will take care of it. Hey, at the end of the day, I trust Dr. Blau is gonna be a good doctor for the job. Well, I've been working out pretty much since high school. It helps and hurts in different ways because it's a complex problem. When you're building your muscles, everything, you obviously look better when you're a little more solid and less flabby. But the problem is that, developing certain muscles sort of exacerbates the way that it looks. So it really depends. It's not something that I could just exercise away. So this is my closet here, and one thing that you have to think about when you have gynecomastia is your wardrobe. You try to wear loose clothes instead of form-fitting ones. Dark colors work pretty well because, they hide the shadows and stuff like that. Go for burgundies, dark oranges, navy blue, black. Those are the colors that work really well. Thicker fabric always helps. You always feel that gynecomastia is just a barrier there, especially with girls. It's like they're gonna look at you differently. Something is just a very visual and obvious flaw. So it's something that, it'll hinder your confidence. I haven't had a long-term girlfriend. Maybe this condition has had something to do with it. Taking my clothes off in front of girls has always been something that I would always have in the back of my mind that would be an issue, but if you can't see it with my shirt on, then you must be blind. I've made a huge attempt to try to hide it. I just want to feel more comfortable with myself.
Okay, basically, first I'm starting with the incision. The incision is going to be right here, so it's a small incision. It's about 1 inch incision. Christian has a severe or large gynecomastia. It's the 5% largest gynecomastia that I see, and I saw thousands of gynecomastia cases. I can feel hard tissue. This is really gynecomastia, and there is some fat, so it's a combination. So here we're going to do the lipo.
I've heard of some pretty bad stories of doctors that didn't do a good job with the surgery. Some pretty bad scarring was the result. Any surgery is still surgery. You're still getting cut into it. It has its inherent risks. I definitely think that having this surgery is going to make me more confident with girls. My dealings with everybody, really. I haven't told anyone about the surgery. I want to surprise everyone. I want to just show up one day and be like, "Hey guys, how do I look?"
so you can just have a seat and I'll be right with you.
All right, thank
Okay,
you.
Christian.
90% of the reason why I want to do this is because I personally feel uncomfortable with myself.
Gynecomastia literally means a woman's breasts in a man. It's the same breast tissue that a woman would have.
I'm gonna start an intravenous, put on the monitors, and with some medicine in the intravenous, you'll start to relax, and then you'll drift off to sleep.
After the surgery, I want to be able to look in the mirror and be more proud of what I see.
See here. How you doing, Chris?
All right.
Okay. Gonna be going off to sleep in a few minutes.
So now I'm going to do the liposuction. You can see slowly the fat. It's pure fat that is coming out. Now what I'm going to do is really the most important part of the surgery, which is the excision of the gynecomastia, or the excision of the glandular tissue. I'm trying to isolate the glandular tissue, which is hard tissue. There was a little bleeding, excessive bleeding I found, so the surgery took a little bit longer. But otherwise, everything went very well. Since it's in such a location, you really don't see the scar. We removed all the glandular tissue, some of the fat tissue, and I think he's gonna like it.
So after the surgery, when I got my first real good look at it, I was excited. It was just happy, you know, it was great. I saw the contours of what it's supposed to look like. The breast tissue was down to a normal size. I could see the muscle more clearly underneath. Now that my recovery phase is pretty much done, I'm really excited to go out and just go to the bars, and I definitely think I'll be a lot more confident around girls. What up?
What's up, man? How's it
How you
going?
doing? Not bad.
Good, man.
Christian's self-esteem definitely seems higher since after his surgery.
I'm Chris. Nice to meet you.
Nice to meet you too. I'm
Want to sit down?
Yeah, sure. Where are you guys from?
He seems to approach girls with a greater ease than he did before.
And you guys should call later.
All right, absolutely.
So you can definitely see that this surgery changed a lot for him and made him a lot happier.
It's definitely worth it, and I don't regret, you know, any of the investment, any of the risk. It's an absolutely fantastic situation right now, and I'm happy to have gotten surgery.
It was really nice meeting you. Bye. Cheers, guys.
Cheers.
Have fun.